Hi, and welcome to the Vinton method. Welcome to our office and welcome to our website. So if you've watched the initial video on the homepage, you have a better understanding of what the Vinton method is. In short, it's 6 physicians, 3 medical physicians, 3 doctors of chiropractic, in one of the world's most technologically advanced private facilities. We've spent over 3 decades. We've spent worldwide travel, millions of dollars to make sure that we have the finest private facility to help our patients, half of which come from out of state every day. So, how does this apply to the crippling and second most common reason that people see a physician, back pain or neck pain? Now, to start with, your family doctor is well-meaning. There's no doubt. Nobody goes through 8 years of schooling who doesn't care about helping people. The unfortunate part is, the number one reason people see a physician is a respiratory infection, right? The common cold. The number 2 reason is back pain. And so what happens is, unfortunately, and I kind of know how this happened, and there's a chapter in our book, which is on the homepage, that discusses kind of how this happened. But your family physician gets less than 4 hours of training in all their years of education, right? 8 years of medical school, a few years of a residency, another few years of a fellowship, and they really don't understand what to do with back pain. Remember, we also discussed that of the 132 medical schools in the United States, only 6 teach a class on pain at all. So, back pain traditionally gets handled with steroids, muscle relaxants, physical therapy, which is of very little use for most degenerative back pain. And as a result, people go on to suffer. The research is very clear that first you see your family doctor, who sends you to a therapist, who then sends you for medication, who then sends you to pain management, who then refers you to a surgeon. 75% of back pain sufferers still suffer with pain and disability 12 months after their initial appointment with their family doctor. It can ruin your life, it can ruin your career, it can ruin your enjoyment in the activities that you love. So what makes the Vinton method different? Number 1, again, it's a head-to-toe evaluation. So we can clearly see what the cause or causes are. Is it mechanical? Is it neurological? Is it autoimmune? Is it something as simple as maybe a dropped arch in the foot that causes a imbalance in every step you take, causes a wear in your pelvis? What causes it? Is it a misalignment? Is it a subluxation where the bone has misaligned and causes abnormal motion and nerve function? Has it degenerated to the point of stenosis? Like, you don't have to feel stenosis. Like, you don't feel your arteries clog. Your first warning sign is the heart attack or the stroke, right? So what happens is because we have pain management specialists, medical physicians, neurologists, very advanced chiropractors, right? Doctors of chiropractic, who we have one of the top facilities in the world in this department. We train doctors from all 50 states, every province in Canada, and 11 foreign countries have been to our office to study our methods. The point is, simply, there's nothing better for back pain. So, we begin with the head-to-toe evaluation. We begin with a postural to check and see, do we have more weight on one side, forward or backwards? Is there something posturally going on? We scan the arches of your feet with a 3D laser scanner. We do, of course, a physical and orthopedic and neurological evaluation. Of course, we have the thermal cameras to see what's happening deep inside your body that might be missed by other exams. I studied and taught with the inventor of electromyography, Dr. Jeffrey Cram. So we can look at the electrical activity between your brain and your muscles to look for abnormal patterns. We possess the myovision, which, according to the American Medical Association's guide, is the most reliable way to determine pain. So we can monitor your motion as you move with a digital inclinometer, as well as watch your muscles to see, let's just say when you move, a muscle should fire and then go quiet. People who have chronic back pain, their muscles will stay tight. They won't let go. We can record all that. We can see that, so we know what to do with that, right? Of course, we do standard x-rays. We do motion, what's called fluoroscopy, more motion x-rays. Of course, MRIs. Let's just take a brief moment about MRIs. So for starters, your family physician is never taken or learn how to read an x-ray or an MRI. They only read the report from the radiologist. Now you think, well, that's the radiologist, right? That comes from the hospital. He's the highest level in this. He certainly must know what he or she is doing. What people don't know is twofold. Number one, there are two types of radiologists. The first is your standard radiologist, the most common type. And out of their 12 years of training or schooling, they get 2 weeks on the brain and the spine. That's not very much. You can tell because the reports are usually 1 line, maybe 2 lines. It doesn't cover very much. They're very general. Number 2 is a neuroradiologist. Now, a neuroradiologist gets 2 years studying the brain and the spine out of their 12 years. So when a neuroradiologist reads the same report that a radiologist just read, or the same MRI, they'll find an error 45 to 95% of the time. So when your family doctor just looks at a report, they don't know. They've never seen the image. They don't know that half or more of the information is either not reported or just completely missed. See, I study with a neuroradiologist, Dr. Peister out of the University of New York, right? So I read my own MRIs. Of course, we look at what the radiologist said. More eyes are better, but we read our own, and I can agree. We find more than half the time important information that's on the MRI or the X-ray or the CAT scan that is not in the report. So accurate diagnosis leads to accurate treatment. Again, we have 6 physicians in our office, and I would say the medical physicians, again, they've never been trained. They don't know. The other chiropractors, they have the class we had in school, but they don't know to the level that I have studied MRIs. I've looked at tens of thousands of them over the years. So the end result is again, accurate diagnosis, right? So, and by having the thermal cameras, the SEMGs, and not just having the equipment, but actually study with the people who invented this equipment, like Dr. Jeffrey Cram and I taught together all over the world for a few years, unfortunately, before he passed away. So, and the same thing with fluoroscopy. I was doing fluoroscopy back in the early 1980s. So I have a long history of doing fluoroscopy. Matter of fact, we have 2 fluoroscopes in the office, right? So not only are we familiar with it, but we actually are experts in it. And so again, that's why people come from all over the country to get results they're not able to get closer to home. But that's not, the accurate diagnosis is the first thing. So the Vinton method is a top of the head to the bottom of your feet exam. Helps us understand what the deficits are. Helps us understand whether it's mechanical, metabolic, neurologic, autoimmune. What's the cause of it, which is vital, right? Then we have the best of the best tools, technologies, and techniques. So from the chiropractor standpoint, which is the obvious sense, because the chiropractor is able to help 98.5% of people avoid ever stepping into a surgeon's office, right? So if you're back pain and you go to your medical doctor first, your chance for having surgery is about 43%. If you step into a doctor of chiropractic's office, your chance for having surgery is 1.5%. Big difference, right? But where we go far and beyond, we don't do any of the twisting and jerking and cracking that people often associate with seeing a chiropractor. We use instruments, and our results are phenomenal. Again, we've taught doctors from all 50 states, every province in Canada, 11 foreign countries over the last 3 decades. We've done research. I have degrees in research. There is nothing better on the planet from that standpoint. We have all the tools that most doctors don't have or maybe not even aware of. And then we move into the VAX-D, the vertebral axial decompression. I actually studied with Dr. Dyer for 15 years before he passed away at the age of 96. And you'll see the videos down below. Like, what is that? That is not traction. That is not what they call spinal decompression. VAX-D is the gold standard for decompressing and helping discs to rehydrate. There's tons of videos below on watching what that does. But that, in conjunction with our very specific brand of neurospinal alignment, our head-to-toe evaluation to address any other deficits. But then we move into class 4 lasers. You know, most doctors, and you'll read about this later in the video, but most doctors use a class 3 laser, right? Just because it's what they call a cold laser. Well, the cold laser doesn't make a lot of energy, so it doesn't barely get below the level of the skin. A class 4 laser, you have to be a physician to get. We have the same laser the Pittsburgh Steelers utilize, and it's class 4, so it's very powerful. It goes clean 6 nanometers deep into the body, clean down into the disc, into the bone, to help the swelling around the nerve and the inflammation and the blood flow into the disc to help it to heal in conjunction with the VAX-D. We also have pulse electromagnetic field therapy, right? But unlike standard pulse electromagnetic field therapy, which is very low, you can barely feel it, it takes weeks and weeks to even see a result, we have the pulse centers, right? The most powerful PMF you can purchase. And again, it gets into every nook and cranny. There's videos below on that. But every nook and cranny to reduce inflammation, increase blood flow, cut healing time significantly. And again, in conjunction with the VAX-D and the neurospine alignments, and again, all the other things that we might do, helps things to heal. Then on top of that, right, so we have the pain management, so we can do all the things that your traditional family doctor does. We have a team of surgeons if you need one, but less than 1%, so maybe 1 to 3 patients a year do we feel might benefit from surgery. But then we have one of the top spinal programs in the country for regenerative medicine. We have doctors who are specialists who've done millions, at least 2 million injections into the spine. We have an entire operatory that's sterile with a 90-inch monitor, large fluoroscope so we can see what's happening as we're doing it. And we would never use cortisone, right? Most people have had the epidural injection. We do not, and nor do most medical journals recommend doing those. They're very damaging. They're not FDA cleared for the spine. And the amount of steroid that your body naturally makes is the height of a matchbook. The amount of steroids in an epidural is the height of the Empire State Building. That's why you can only have 2 or 3 in a year's time. But look, the research is very clear. The Journal of Neurosurgery states that the amount of relief is so small for so few people that it's not even viewed as clinically meaningful, and what the epidurals really do is delay proper treatment. So if VAX-D and the alignments and the lasers and all that are it's beyond what that can help, our regenerative medicine program, where we inject PRP, your own blood platelets, under fluoroscopic guidance into the damaged joints and discs, and or bone marrow aspirates, stem cell injections into the spine, right? That is so cutting edge. We're so far. Well, we've always been about 15 to 20 years ahead of the curve, and what we were doing 20 years ago is now becoming more and more mainstream, but now we're still 15 years or 20 years ahead of them. It is one of the most cutting edge, technologically advanced clinics in the country, with a team of physicians who specialize in these specific procedures. As a result, we have a very wide, a very deep toolbox with an incredible number of doctors who have specialized in this. We have combined 157 years of experience. We're in 34 years at our current location. And again, there's no clinic on the planet that has what we have under one roof. Well, we've met some offices that have a piece or maybe 2, but nobody has the plethora of what we have under one roof, let alone the 6 different physicians of different specialties. And again, that is why people come from all over the country. That's why we're invited to speak at conferences all over the world, is because it truly is one of it's the top clinic that does exactly this. So with your spine, when you have spinal surgery, so if you talk to people, most people say, you never have spinal surgery, and they're absolutely correct, because their statistics, not ours, but their statistics, are that if you have, let's say, a spinal fusion surgery, which is the most common nowadays, 53% of those will fail, and you'll be worse off within 6 months. 90% will fail, and you'll be worse off within 4 years. It's the third most common thing that we see in our practice are people who've had the surgery and it's not gone well. And so that's where the lasers, the class 4 lasers, and the PEMF, and the alignments, which we can do even if they've had the surgery with the hardware, and the injections of the PRP or the stem cells, or again, all the other tools that we have. I mean, those are some of the tools, but there's probably 8 or 10 different tools that we have. So when people call, they always want to know, well, what's my treatment going to be? And the answer is, I have no idea. Because we have to first do a comprehensive evaluation utilizing the Vinton method to determine exactly what your unique situation is. Then we'll pick the 1 or maybe 2, maybe 3 options that are best suited short and long term for what you have going on. So once we've done that, then we can best describe, here's exactly what we need to do. And again, we do exams every 10 days, so we need to be seeing improvements and lasting improvements. The good news is, statistically speaking, 76% of people notice improvement by the 2nd week, 88% notice improvement by the 5th week, 96% still notice improvement 4 years later, which means, generally speaking, when it's fixed, it's fixed. And so, again, by having the breadth and the depth, it is way beyond just seeing your local chiropractor. Physical therapy is excellent if you've been, let's say, bedridden for 3 months because of other medical condition. But, we've seen patients who hurt themselves at the gym, had to be carried to the hospital back of a pickup, and they're sent straight to physical therapy. Now, you tell me at what point between the gym and the hospital did they become deficient in exercise? That's not how you solve it. It's a mechanical issue, right? And so, as a result, the videos below will discuss that more in depth. Or we had a woman who fell off a chair and landed on the floor and suffered with terrible back pain for over 3 years. Did the therapy, had the shots, took the pills. But nobody ever did an image. Nobody ever did an x-ray and MRI. Your family doctor traditionally does not order imaging studies. If you go to the emergency room, maybe they'll do x-rays, maybe a CAT scan. The emergency room never does an MRI, right? So we'll come back to the MRI thing in just a moment. But so in her case, we actually did an exam, took some x-rays, got an MRI, and realized that when she fell off the stool hanging the curtains, that she herniated 3 discs. So we did exactly what I've just suggested. We actually helped her heal those discs. She got better. She was very happy. She referred 8 additional patients to our clinic. And again, we were able to get to the root cause. See, we're a functional and a regenerative medicine practice. We're root cause medicine. We don't just simply write a prescription to try to numb it. We just don't do surgery because, well, we don't know what else to do, even though we know surgery is going to fail and leave you worse off. Anybody you talk to says don't have a back surgery because it generally doesn't go well. There are times when there's nothing else, and I get it, maybe a 1%. Even the best surgeons say 1 to 4% will benefit from surgery. The rest long-term don't do well, right? And even the surgeon who says, oh my God, we have a 98% success rate, you need to understand what they're talking about. And what that means is this. It means 98% of the time they cut you open, they do what they do, either take a piece out or put a piece in, rods or screws or whatever. You don't get an infection and you don't die. So therefore, the surgery, from their point of view, was a success. However, if you then ask the patient, can you go back and live your life? Can you do the things you want to be able to do or just exist without pain? That number is below 17%. So again, when you're throwing out percentages, are you talking their percentage or your percentage? We talk your percentage. When we say 90%, 98%, we mean that you just go on and live your life without complications of surgery. Now, back to the MRI for just a moment. So people think an MRI is everything. But here's the deal. First of all, as we said, it depends if a radiologist or a neuroradiologist reads it. That's number 1. Number 2, depends on how busy the MRI center is. See, when you look at an MRI, there's 2 views, one from the front and one from the side. And there's slices that come through the disc. A lot of facilities are in a hurry. So their slices don't cut clean through the disc so that you can't get a clear image of what is on the MRI. That's number 1. Number 2, MRIs, again, because MRI facilities make money by getting people to do MRIs, they do slices and then what's called a gap. Usually it's a 5 millimeter slice, which is a thick slice, and then there's a 5 millimeter gap. Now, so what happens is so therefore they slice and skip, slice and skip. If your problem, well, number one, wasn't in a clear slice of the disc, or number two, was in the gap. Therefore, it's not even recorded on the MRI. So you think the MRI is the end-all be-all, and it is very important. However, remember that it's not gathering all the information. That's where the EMG, that's where the thermal evaluation, that's where the postural, the physical, the orthopedic, the neurological evaluation, right? Doctors don't touch their patients anymore. They just look at a film or read a report. We actually still touch it. We actually do other tests to make sure that we have all the data, because the correct data leads to the correct diagnosis, leads to the correct treatment. And if you think just because your doctor or orthopedist have been in practice a long time, and they must certainly know, well, if they're doing surgery on more than 1 to 4% of people, no, they don't. And with all the people we see who've had a bad outcome from their surgery, no. And it doesn't matter if it was so-and-so's famous doctor or whatever. All surgeons just understand that the nature of surgery is you're never quite right after, because you've taken pieces out or you put pieces in, and as a result, we do everything we can to help people. And like I said, we help about 98.5% of people get out of pain and or avoid a surgery. We work with some of the top surgeons in the country for that other 1.5% who need some help. Some specialists out of Florida. We use a neurosurgeon, which you'd always want if it does come to surgery, which again, less than 1% of the time does it. But you definitely want a neurosurgeon over an orthopedic surgeon. They make less of a mess basically when they do the surgery. Smaller holes, less tissue damage, etc. But again, it's very rare that we have to do that. And even then, when we do, the last couple of people we referred, they said, no, there's nothing more can be done. So we did everything that was possible. But understand, we're only talking 1 to 1.5%. The other 98% get better on track. They're happy. And when you go on a month, 3 months, 6 months, a year, 2 years, 4 years, they still maintain that correction. That's what it is that we do with the Vinton method. So again, look around. And certainly call and schedule your evaluation. We're going to spend 45 minutes to an hour together. We don't double book, so that is your time. And we'll do the tests that we feel are necessary to get to the root cause or the bottom of your problem. And then we'll make whatever recommendations we need, whether it be a simple recommendation or a more complex recommendation of the options that we offer. Probably 80% of them, 90% of them are covered by most major insurance carriers. There's 3 or 4 that may not be, but we would have a full discussion before that ever occurred. Keeping in mind that your insurance primarily covers drugs or surgery. Even standard things like physical therapy. Aetna and Cigna were down to 1 visit of physical therapy. Blue Cross was down to 4 visits of physical therapy, or 4 visits, 1 to 4 visits to the chiropractor. And you can't get a lot done with that. So there's never a charge for that initial evaluation. Hasn't been in over 3 decades. We had this woman named Shirley ask us 11 times in the course of 1 exam if what we were doing next was covered. And it was just so disruptive that we barely could finish the exam. So at this stage, the doctors and the staff just decided that there would never be a charge, right? We feel that it's our community service, because we have methods and options that your doctor doesn't know, your chiropractor is not familiar with. Your surgeon, again, his job is to do surgery. I actually studied once with a surgeon. He's one of the top surgeons in Puerto Rico. And he actually bought 4 VaxDs to take back to his practice, because he said, 1 to 4% are true surgical candidates. The rest, we just make worse. And so now he's getting all these patients better that he could not before. And again, because we have that, and we have one of the top regenerative medicine spinal programs in the country, and because we have the neurospinal alignments that's different, and it's not painful, and it's very comfortable to receive, and because the class 4 lasers and the PEMF and all the different diagnostic tools, the key thing starts with that head-to-toe exam to figure out exactly what's happening. And again, 1 in 10, oh God, maybe 1 in 20 or 30,000 doctors would even think to look at those things that we look at. But again, it's just been 30 plus years of asking the question, why? What's the best method? And again, some of the other doctors in our clinic, they specialize in what they do. They don't know how to read an MRI. They don't know what some of these advanced technologies do because they're specialists in what it is they do. But part of my job, what we've done, what I've put together in the last 34 years in being in practice with working 6 days a week with 10, 12, 14 hours a day, millions of dollars in investment, worldwide travel, is put together the best of the best under one roof. And like I said, very proud. My wife always tells me I shouldn't brag, but I'm like, honey, if it's true, it's not really bragging because this is all intentional. I mean, we've been all over the world. We've trained people from all over the world. We know, like, this guy has this one thing or maybe these two things, but they do not have the plethora of what we have under one roof. Nobody does. And that's why we're so confident. So your first thing, schedule an evaluation. If you haven't gotten the results that you're looking for, or you're looking to avoid having a surgery, you definitely owe it to yourself to give us a call. Spend the time. There's no charge. There's no obligation. If we're able to help, and we usually are, we will tell you. If we're not, if you're one of that 1.5%, we'll tell you that as well. So when you're ready, you call the office. The phone is answered 24/7. They'll take a message, and one of our physicians will personally call you back and then see exactly what's going on. And once we confirm that this is something that we can help so we don't waste each other's time, we'll go ahead and schedule your evaluation, and you'll join the group of patients who are able to go back and do the things they want to do without the crippling mess of neck or back pain. We look forward to meeting you, and just call the number and we'll be glad to help.